Hello, my name is Rochelle Burris. I've chosen to review the book Good Kings, Bad Kings by Susan Nussbaum. I've chosen this book mainly because I work as a school nurse for a middle school, so I see a lot of these vulnerable populations and groups at work every day. So who are the vulnerable groups that we're talking about? In a nutshell, the groups represented in this book are children and juveniles with disabilities. First and foremost, they're children, a very vulnerable group. Children can't really advocate for themselves or really know what they need. They're a pretty helpless population sometimes. Another one is the physically or mentally disabled. A lot of the characters in this book are both physically and mentally disabled. Children who come from low-income households or they don't have access to health insurance. Another group is the minority groups. So there are a couple of minority groups that are represented in this book. The Hispanic population, African American population are a couple of them mentioned. And then lastly, the homeless group is represented with this book. And like I said, day-to-day basis, I see children. I see physically and mentally disabled children, children who come from low-income households, minority groups. So that's why this book really interested me. And it was really sad to see the mistreatment of the kids in this book. Health disparities that I saw throughout the book were, first of all, lack of access to healthcare, or the quality of healthcare was lacking. A lot of these kids didn't really have access to healthcare, and when they did, the quality was extremely subpar, was not good enough. They had a nurse in-house, but a lot of times they would ship these kids out for treatments and tests that they didn't really need just to get the money out of it. It was just a big money thing. Another health disparity would be lack of physical activity. These children are wheelchair-bound, many of them. They denied them access to electric wheelchairs, and they can't really get around on their own. I didn't see any mention of passive or active range of motion exercises, anything like that. Poor or inadequate diet, also food insecurity. So a lot of times as punishment, these kids would have to miss meals. They would be stuck in a timeout room, they would miss dinner, or they would miss lunch, or they would have a delayed meal. So, and then when they did eat, the food that they had was not adequate healthy food for growing children. Another health disparity that I noticed was lack of mental health resources. Many of these children had mental health issues. So schizophrenia was listed, depression, anxiety, and they just kind of had to deal with it. A lot of times they wouldn't even get their medications if the children didn't remember. So the nurses were not making sure that these children were getting their medications on time. Obviously, mortality is a big one when you take into account all of the rest of it. These kids are already, frail, basically, and when they're not getting adequate diet and they're not getting exercise, they're lacking in the healthcare area, then the mortality rates are going to be higher. And we did see that throughout the book. Joanne, who was a main character in the book, actually noticed that within a certain, I think, 7-month span, there were multiple deaths and preventable deaths at that. So health promotion recommendations. A few that I came up with was, first of all, research. So just getting qualitative and quantitative data. Like I said, Joanne was one of the main characters. She was disabled. She had quadriplegia, but she actually worked for this company. She was not a resident. But when she really dug into it, she noticed that a lot of these kids just weren't getting the care that they needed. She spoke with the kids, got to know them, she looked through their charts to see, how many people had died, what were they sick with, what kind of treatment did they get. So that just gives you kind of a starting point on what needs to be worked on. Also advocate. So advocating for their mental health, for their physical health, for their diet and exercise, just being able to advocate for these children because they can't and don't really advocate for themselves. Physical activity, since it's lacking, I would say come up with games and activities to promote physical activity. So just, helping them throw a ball, or coming up with games that make them move, or dance activities, or anything like that. Passive range of motion exercises for a lot of these kids would go a long way, especially, getting in there and turning them every couple of hours would probably help tremendously with bed sores, that kind of thing. I think wellness checks, like regular wellness visits with a physician outside of this facility, would be beneficial, especially because, come to find out, this whole facility and the doctors and hospitals within it, they're all corrupt. So just getting those children their wellness checks, making sure they're growing well and eating well. Additionally, an in-house counselor or therapist. I said in-house because they don't really have access to transportation. So this would give them a way to be able to talk to somebody. Many of these children have gone through trauma, abuse, and neglect before they even came to the facility. So a lot of mental health issues that need to be addressed. So as new nurses, what can you learn if you're a new nurse from this book? First of all, question it. If it doesn't make sense, if your gut is telling you something is wrong, question it. Don't just think just because someone's been there longer than you have that they know what they're doing, that they're doing the right thing. Things are always changing. So sometimes a fresh set of eyes is what's needed to change the system and make it better for the patients. So always question it. If you have any doubt, or like I said, your gut is telling you something, then ask somebody about it. Patients are people. So this might be like, well, yeah, patients are people. We know that. But when you get in the hustle and bustle of really nursing, sometimes you get so busy on tasks and you get task oriented, and you really forget that this is a person with feelings and emotions and a history and a whole lifetime of experiences. So just remember that. Take time to listen, take time to sit down, eye contact, physical touch, that kind of thing. So having self-awareness as a new nurse is super important. Just knowing what stigmas do you hold with a certain population, and what beliefs do you hold, and how is that going to prevent you from nursing and being the best nurse you can for this population. Just making sure that you check yourself before you check in with your patient. Educate yourself, continue to learn. There's always new and better stuff out there. So stay up to date on what best practice is, evidence-based practice. Bring new stuff into it. Offer, a new set of eyes, but just continue to educate yourself throughout it. And again, advocate. So advocate for these patients. They are vulnerable, even just being in a hospital setting, being sick, but in this book specifically, children, people with disabilities, they're very vulnerable. They need someone who has a voice and can speak up for them, and someone who has the knowledge, the medical knowledge and background to do that as well. So seasoned nurses, what can you learn as a seasoned nurse? First of all, don't be stuck. Don't be stuck in your ways. Don't think, oh, just because we've always done it this way, we're going to continue to do it this way. Be open to new possibilities. Things are always changing. There's new inventions and all kinds of new medical advances that happen all of the time. So just don't be stuck where you're at, and be open to learning. Keep your compassion. I know a lot of times it's hard not to get burnt out. Nurses are caregivers, caretakers, so just keep your compassion, keep your positivity. It goes a long way. Evaluate and reevaluate yourself. So this kind of ties into the self-assessment for new nurses. Seasoned nurses, make sure that you check in with yourself every now and then, just to make sure that your beliefs and your values and your whatever stigmas you hold, they're not getting in the way of the way that you're treating your patients. Demand a safe work environment. So staffing is huge. I saw that throughout this book, is the lack of staffing. Teddy in the book ended up dying because there was not adequate staffing. Someone left him in a shower. The hot water burned him so bad that he succumbed to his burns and he passed away at 22 years old. Again, advocate, teach to advocate. So we're seeing a theme here with this vulnerable population. Just make sure we're advocating for these children and for these people with disabilities, people who can't speak for themselves. Nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So what surprises did I come across in this book? I was surprised that patients were recruited. They were picked up off the streets, sometimes, from a homeless community. And honestly, the care that they got within this facility was probably worse than what they had out on the streets. Just the frank abuse and neglect in this book was awful. I know it exists. I know it's out there, but just to read it in detail was pretty shocking. The number of deaths that were swept under the rug or were minimized or just explained away, that was really sad because many, if not all of those, were preventable deaths. And they were just kind of, well, this is a frail population kind of thing, so it just happens. But really, that's not what it was. It was the abuse and neglect that did it. Also, the interdisciplinary team, I use that word loosely because it was a set of, doctors and hospitals and administration, and they were basically using these patients, sending them out for tests and that kind of thing just to make money off of them. So I was a little surprised that so many people were involved and nobody wanted to be the whistleblower, probably because money was so heavily involved. What stuck with me? So the characters in the book really stuck with me. Mia, Teddy, Pierre, they all had different disabilities. They were really severely abused and really severely neglected, and it was just really heartbreaking. And then the children protesting at the end of the book was a really cool thing to see them all coming together and make positive changes. How'd this book make me feel? So I felt some anger, some sadness, and then, I felt proud of the good kings within this book. So the staff members that actually advocated and cared about the patients, felt proud of them, and I felt proud of the resident that ended up starting the protest. So that was pretty cool to see, and also motivated, just motivating me to do better and teach others to do better within the nursing world. Questions that I'm left with: where were their parents or guardians? Why did they not have any cell phones? Nobody had access to a cell phone or a computer. How could so many people turn a blind eye to the abuse and neglect that was going on with these children? So I have a question for you. When it comes to good kings and bad kings represented in this book, the staff who abused and neglected and turned a blind eye were the bad kings, versus the good kings were the ones that advocated and stood up for these vulnerable children. When it comes to you and the health and advocacy for your patients, are you going to be a good king or a bad king? Speak the truth even if your voice shakes. Thank you.